Ready?
Yep.
Okay. All right, so we're here with Zach, and we're going to go ahead and do a head-to-toe assessment. And then I'm going to go ahead and wash my hands and perform hand hygiene and then ensure patient privacy. I'm just going to go ahead and have you sit down for a second. All right. And then while I did that, I've noticed a couple of things. I'm assessing the room, noticing if there's any tripping hazards or if he's attached to any medical equipment such as oxygen or any IV situation. I also can tell that, yeah, a couple of things just from the initial assessment. He's responding to me, his eyebrows are lifting, he's giving me eye contact, and he's following me with his eyes. So a lot of the neuro assessment is already done. So we're going to go ahead and then look at, just do a quick look, and I'm just going to go ahead and just look at his skin. And it's normal in color. We're going to notice if there's any edema. Can you feel this?
Yep.
Yep, and you can feel that?
Yep.
All right. I'm just going to look at the feet real fast, and then you can feel all that?
Yep.
Yep, and I don't notice any edema. I don't notice any moles or any alterations in color or skin lesions or skin tags or anything. So then we're going to go ahead and start with our head to toe assessment. And then I'm going to go ahead and start at the head. And then this, I'm going to look and notice that his hair is well kept. It's not knitted. I'm also going to look here for like if there was possibly any lice or any moles or lesions that we aren't seeing because it is covered with hair and I don't see anything. And then I'm also going to look at, look at me. All right, I'm going to see facial symmetry. I don't see any drooping. And then if I did notice anything was out of the ordinary, I would do a more thorough cranial nerve assessment. But he's responding to everything, so I don't really see the purpose of that. I also noticed that he doesn't have conjunctiva around or pink eye or any eye drainage. Everything seems normal. So I'm going to go ahead and then do our eye assessment. I just need you to look at my nose. And then I am going to, okay. And then they were both reactive to about 3 centimeters. And then, so the pupils were equally round and reactive to light, but I'm also going to do accommodation. And I'm just to stare at this and then follow it out. And it's accommodated. If I had any other problems, I would do the 6 cardinal fields of gaze, but I didn't see any issues with that, so I don't feel the need to do that. So now I'm going to look at his mouth, and then you need to open up, stick out the tongue and say ah. And then that right there would assess another cranial nerve. But then, do you have any problems swallowing? You're okay. Do you have any problems swallowing? No? Okay. Do you have any problems chewing?
Nope.
Open your mouth one more time. Okay. And then I don't notice any chipped teeth. At this point, I would also be able to like notice if there was periodontal disease or gingivitis, and I don't have any sense of that right now. So that should be okay. And then you don't have any problems swallowing or anything, correct?
Nope.
And then, no, okay. And then I also noticed that his mucous membranes are moist. And then, so that's a plus. And then, so now we're gonna go ahead and, since I could check lymph nodes, see if there's any swelling, but since I'm already here, I could check for the carotid pulse. And then we would normally do this for 60 seconds, but due to time constraints on the video, we're not gonna do that. But I would compare bilaterally, and I wouldn't do these at the same time because you don't want to constrict blood flow to the brain. All right, and I noticed that the pulses were fine there. I'm also going to check your pulses here. Oh, one right now. And then it is a 2+. And then check here. And then they are, that's a 2+, and then I'm going to go ahead and then I'm going to, normally I would do this under the gown, but then we're going to go ahead and check your pulse. And then we're going to start at the aorta. And again, we would do this for 1 minute. And I hear a normal sinus rhythm. I don't hear any S3s or S4s or anything abnormal. And I'm going to go ahead and then we're going to go to the pulmonic. I'm going to Erb's point. I'm going to mitral. I'm going to tricuspid. Okay. And like I said, they were 2+. They were normal sinus rhythms. There was nothing abnormal about it. I'm also going to have you go ahead and lay down, because then we can go ahead and check your posterior tibialis and your dorsalis pedis. And then normally we would again do this for a minute, but due to time constraints of the video, we're not. But we will do it for 15 seconds. Okay, and then I would just multiply that by 4, and then I got 80. I'm going to go ahead and do a comparison over here. Again, it's 2+. Okay, once again, I got 20, and then just for verification, I want to verify that they're the same. Okay, and then this one. Okay, I like the 20 as well. All right, so then since you're already here, we're going to go ahead and do your assessment. When was the last time you went to the bathroom?
10 minutes ago.
Okay, well, we're good. All right, I think you're just the belly. There you go. And then I'm going to look and notice and see if anything is distended. Everything's flat, as it should be. He mentioned that he just had a bowel movement 10 minutes ago, so we're going to go ahead and listen to bowel sounds. And I'm going to go ahead and count them for a full minute, but for the purpose of the video, we'll only do it. Then we'll go up to the upper. Go here to upper. Look lower. And those were normal, active, all 4 quadrants. If it was hypoactive, if it was less than 5 per minute, it would be hypoactive. If we didn't hear any, we would listen again for 5 minutes, and then if we didn't hear anything, we'd get somebody else to listen or call the doctor. Now we're also going to go ahead and then just palpate the area. Any tenderness? Does it hurt or any?
Nope.
Nope. Okay. Okay. And then I didn't feel anything abnormal. I didn't feel any organs enlarged, and he didn't mention any pain. All right, so then we're good. And then, so I'm going to go ahead and have you, I'm going to go ahead and have you stand up. And then I'm just gonna have you walk. And then I'm gonna assess this gait and then come back. All right, and then did you have any problems?
Nope.
All right, and then I'm just gonna have you bend over and look at your spine real. Look, we're gonna look at the evenness of the spine. Nope. We're gonna notice if there was any scoliosis, which there isn't any. It's well defined in the middle. We didn't see any kyphosis or any lordosis at all. All right, you're fine there. But since you're up, and then, well, yeah, we'll go ahead and. I'm just gonna go ahead and start listening to some lung sounds. You're good. All right, you stay there. Let me take the shirt off. We'll just say that we're doing this without the shirt on, and then let's start with the back. And then, yeah, I just need you to cross your arms, so that way, when we do listen, we're not going directly over the bone, so we can actually hear breath sounds. So I just need you. We're gonna have you breathe in and out for each time. Okay. Breathe in and out. And in and out. And it's clear. I don't hear any pleural rubs. I don't hear any bronchi. I don't hear any wheezing. It's just a clear inhalation. But we're going to keep going down. Out. We're comparing bilaterally. In and out. In. Out. In. Out. In, out, in, out, in, out, in, out, in, out. All right, go ahead and have a seat, and we're going to go ahead and do the same thing just to the anterior, to the front. Do you have any problems breathing? Do you have any history of asthma? No? All right, and no history of bronchitis, and then none of that. All right, so we're going to go ahead and again start with the breath sounds for the front, and then we're going to start above the clavicle. Breathe in, out, and compare. Out. And again, this would be under the gown. And once again, these are clear, no bronchi, no wheezing, no pleural rubs. In, out. All right, so now that we're into the fourth intercostal space, we'll be entering the middle lobe, in and out. But only on the right side, so in there. All right. And then once again, clear. All right, over here. On the other side. Oh, sit up, careful. And then we're going to go the lower. And the lower lobes were clear. And again, no evidence of like bronchi, wheezing. Everything was fine with that. And then his breathing was normal. We didn't see any unevenness in the chest raise. There wasn't any difficulty with that. All right, so then, since you're here, we can go ahead and then just have you lay down this way. All right, and then we'll go ahead and start doing some musculoskeletal push and then pull. All right, and then, all right, I didn't have any problem with that. Are there any numbness or tingling when I do that?
No.
All right, so then I just need you to lift one of your, it doesn't matter which leg. Yep, and then now the knee to the chest. All right, and then push your leg out, and then in, and then push, now pull. All right, now do the same thing with this one. So knee, out, in, push, pull. All right, and no problem with that. All right, it's kind of cold. All right, so if we go ahead and stand up, and then we are almost done. All right, so just give me your hands. Push, pull. All right, so then I need you to turn your head to the left, and then turn your head to the right. Do you have any problems, any tingling?
No.
All right, lean your head back, head to the chest. All right, arms out. Rotate your wrists, and then just, yep, can you rotate them both? All right, and then now let's just pull the arm like a bicep curl, like there, and then pull. All right, fantastic. And then can you raise your arms up? And then bring your arms back. All right, and just, you shrug your shoulders, and then we'll do the final cranial nerve. Can you just push up? All right, and we didn't see anything of that, and then that should be all of it. So thank you, Zach, for everything.
You're welcome.
All right, thank you.